Hi, YouTube fam. I am Angeline, the nursing assistant. Today is Friday, you guys. We have made it through another week. As y'all know from my previous Chit Chat Tuesday video, this is my very first day on my new job. I will give you guys an update on next week. If you have not seen that video, hit that link right above to watch after this video. Let's get into this Friday video. I'm sorry, you guys. I just realized that I did have the TV going on in the background, so that is what you was hearing. But I have took care of that, and we have cut that off. So let's get into this video. This video is about how to prepare for your state examination for a certified CNA. There is 30 major procedures that you will have to perform for certification. I'm just going to throw a few of them out there, and I'll have it listed right here so you can pause it and take a look at it. But just some is your vital signs, and that just consists of your blood pressure, your temperature, your pulse, your respiration. You will have to know how to transfer a patient. You will have to do mouth care on a conscious and unconscious patient. You will have to know how to transfer. You will have to know how to make a bed, wash your hand. Let's see, do your in and out, your output, feed a patient, bathe a patient, do catheter care. That's just a few, but like I said, we'll get it listed right here. All of them, you need to be very familiar with them. And there are things, a lot of them on there are things that you would do every day, on an everyday basis. So I suggest you to do it when you're washing your hand, do it the proper way, so it become a habit. You will do it without even really thinking about it. So a lot of these things you can practice on an everyday basis because you do them on an everyday thing. So that would be my suggestion as far as the skill test and the listing. Just do it. Make your bed up like you would normally make up a hospital bed. Do that every day, and that way you get that practice in, and it'll become repetitious, and you will be doing it without even thinking about it. The morning of your state certification exam, you should be excited. This is the moment you've been waiting on. So you should be showing up with your professional, proper attire, which is a nice wrinkle-free scrub, skid-free shoes. You need your nails clipped, short, and clean. They will look at all of this. Your hair needs to be pulled back. You don't want your hair on your shoulder. It should, if you got long hair, you need to pull it back, put it up in a bun. Wear less jewelry. You don't want a whole lot of jewelry. Also, be sure not to wear rings because you will definitely be asked to show your hand washing technique. So just don't wear any rings so you won't have to be bothered with that. So be ready and excited for your state certification exam. You will want to get there at least 20 minutes earlier than your evaluation. That way you won't be worried about being late. You got plenty of time to find out where you need to go and the area you need to be in So once you get there and you figure out where you need to go, once you go in and you meet your the person that's giving your skill test, you go in, you speak, be polite, listen, follow her instruction, and at this time, if it's anything that you don't understand, this is the time to ask. Ask anything you need before your examination start, because once your evaluation start, that's it, no more questions. So make sure you get a fully understanding what you need to do. And like I said, if you don't understand some of the instruction that she give you, make sure you ask, because I know at this point anyone would be a little nervous. So that's normal. You're going to be a little nervous. So make sure you ask any question that you don't understand at this time. The examiner will choose which skill she will want you to do out of the 30 skills that is listed. Once she tell you what skill she want you to do, you can go ahead on and demonstrate the skill that she asks you to do. But remember, in doing the skill, if you forget a step in doing your skill, it's okay to go back and do it correctly or verbalize it. You can tell the examiner, hey, I missed the step. Before I did this or supposed to do this, I should have done that. You can do that if you realize that you missed a step in the middle of your skill. But if you go all the way through the skill, then you cannot go back and repeat it. So remember, while you're doing your skill, if you miss a step and you remember before you finish, you can go back and correct it. So that is very important. Also, to help you practice on your skill, because your skill test is unlike your written test. You can memorize, A, B, or C, or you do this or that, but it's different when you actually have to perform the skill in front of a person. You're going to be nervous. You may know it very well, but when that examiner is looking at you, watching every step that you make, sometimes you get nervous and you may forget a step. That's why I say practice every day these skills to make it a habit, to make it a routine. You can also find a partner, another CNA that's going for their test, and y'all get together and y'all practice the skill together. Because also you need to really practice your handwriting, because if the examiner pick 4 skills for you to demonstrate and you get all 4 of the skills correct and you fail the hand washing demonstration, you would not pass. Hand washing is very important. So make sure you really get your hand washing procedure down pat. I hope this video gave you some insight on how to prepare for your CNA certification examination. Subscribe, like, and hit that notification bell, because you don't want to miss not one of my videos. Not one. Come on. Let's get it started.